How to treat and cure cutis laxa. Your body consists of many areas of connective tissue, from your heart to your lungs to your skin. People with cutis laxa have disorders of the connective tissue, causing normally tight elastic tissue to be loose. An estimated 1 in every 2 million babies has cutis laxa. The very rare condition affects an estimated 400 families worldwide. Cutis laxa is often an inherited condition. However, some people without a family history of cutis laxa develop it later in life. This is known as acquired cutis laxa. Cutis laxa is either inherited or comes on later in life, usually after an illness. All types of the condition are defined below. Occipital horn syndrome, OHS. Symptoms for OHS typically start within the first 10 years of life. This condition is an X-linked recessive disease, which means only males have OHS. Symptoms include cutis laxa, stomach issues such as hernias, muscle weakness. OHS is associated with milder cutis laxa symptoms. Autosomal dominant cutis laxa, ADCL. ADCL symptoms can start any time from birth to young adulthood. This condition is an autosomal dominant disorder, which means both males and females can be affected. Many people have only cutis laxa symptoms. Others can also have lung and heart problems, including emphysema. Autosomal recessive cutis laxa, ARCL. This condition has 6 different subtypes, depending upon the gene affected. Each individual condition has specific symptoms. For example, the subtype ARCL1A causes cutis laxa, hernias, and lung conditions. Gerodermia osteodysplasticum, GO. GO affects babies and young children. It's an autosomal recessive disorder, so both males and females are affected. Symptoms include loose skin, typically on the hands, feet, and stomach. Max syndrome. This condition causes both males and females to have a larger than usual head, which is called macrocephaly. Additional symptoms include short stature, sparse hair, cutis laxa, acquired cutis laxa. Some people have symptoms, but don't have the genetic changes associated with cutis laxa. This type of cutis laxa is known as acquired cutis laxa. This condition mostly affects older adults. The exact cause of acquired cutis laxa is unknown. However, researchers have considered possible explanations, such as an autoimmune disorder or infection. Symptoms of cutis laxa usually depend upon the exact type of the disorder. The shared symptom is loose, wrinkled skin, elastolysis. Unlike other skin disorders, cutis laxa doesn't cause easy bruising or scarring. People with cutis laxa also have internal problems, such as abdominal aortic aneurysm. A portion of the aorta enlarges or bulges in people with this condition. Another common symptom is emphysema, in which the lungs don't function properly. Other symptoms associated with cutis laxa include developmental delays, eyes that are further apart than is typical, feeding difficulties in infants, fragile bones, lax or loose joints, low-set ears or ears that aren't properly formed, poor muscle tone, short stature, slower than normal heart rate, underdeveloped lungs. Symptoms can vary, even within a family with a genetic history of cutis laxa. Some people may have more severe symptoms than others. A doctor, often a dermatologist, diagnoses cutis laxa. A doctor will start by taking a thorough health history to determine if you have a family history of cutis laxa. Then they'll perform a physical examination of the skin. Genetic blood testing can determine which type of cutis laxa you have. This can be helpful for couples who wish to conceive and want to know their risks of passing along cutis laxa to a baby. Treatments for cutis laxa depend on your symptoms. A team of specialists, including cardiologists, pulmonologists, dermatologists, and surgeons, may treat the condition. Cosmetic surgery can tighten skin that is loosened due to cutis laxa. These results may last temporarily, as the skin can often loosen again. People with cutis laxa should avoid certain activities, including smoking and excess sun exposure. These can make symptoms worse. You can't prevent cutis laxa because it's a genetic condition. Acquired cutis laxa can't be prevented because doctors currently don't know the exact cause of it. Cutis laxa is a very rare, degenerative disorder. Cutis laxa is the Latin term for lax skin. The hallmark of the disorder is unusually loose, sagging and inelastic skin. Cutis laxa is a disorder that affects the connective tissues of the body. The connective tissues create the supportive structure and strength of the skin, muscles, organs and joints. Cutis laxa causes a loss of the elastic fibers that make up connective tissue. In addition to causing loose, pendulous skin folds, cutis laxa can affect the connective tissues that are found throughout the body, including those found in important organs, such as the lungs, heart, blood vessels and intestines. In some cases, this can result in serious complications of the respiratory and cardiovascular systems. There are a variety of forms of cutis laxa. Some forms of cutis laxa are genetic and are inherited. There are also acquired forms of cutis laxa. Acquired cutis laxa can occur due to such causes as a drug reaction or to an inflammatory process, such as eczema. People treated for Wilson's disease are at risk for developing cutis laxa. The disorder affects males and females and persons of all races equally. Symptoms of cutis laxa can begin during infancy or at any time during life. The symptoms and severity of cutis laxa vary greatly between individuals depending on the underlying type of cutis laxa. Symptoms can be mild and only affect the skin. In more severe cases, serious complications can occur. This include emphysema, diverticula of the intestines and cor pulmonale. In some cases complications can be life-threatening, even fatal. For more details on symptoms and complications, refer to symptoms of cutis laxa. Making a diagnosis of cutis laxa includes taking a thorough personal and family history, including symptoms, and completing a physical examination. The skin is examined for the characteristic hanging folds of skin. On stretching, the skin is inelastic and does not recoil to its normal shape as does normal skin. Skin folds appear most severely around the face, eyes, neck, shoulders, and thighs. There is no specific test to diagnose cutis laxa. Diagnosis is often made by examination of the skin and a history of progressively sagging and laxity of the skin. A biopsy of the skin may also be done. In a biopsy, a small sample of the skin is taken to be examined in the laboratory. A variety of other tests may be performed to evaluate overall health and check for possible complications, such as cor pulmonale, anemia, emphysema, gastrointestinal diverticula, congestive heart failure, cardiomegaly, osteoporosis, hernias and aortic aneurysm. Testing may include echocardiogram, pulmonary function tests, chest X-ray and blood tests, such as a complete blood count and chemistry panel. It is possible that a diagnosis of cutis laxa can be missed or delayed because symptoms can mimic symptoms of other diseases. For more information on misdiagnosis, refer to Misdiagnosis of cutis laxa. Treatment plans for cutis laxa vary depending on the severity of the case, the presence of complications and other factors. However, there is no specific treatment that can cure or prevent progression of the disorder. Treatment includes regular monitoring for complications and treatments to help minimize symptoms. Cutis laxa, a connective tissue disorder which may be acquired or present at birth. It is characterized by slack or loose skin which may be thicker and darker than normal. More detailed information about the symptoms, causes, and treatments of cutis laxa is available below. Cutis laxa, symptoms. The types and severity of symptoms and complications of cutis laxa vary between individuals. Not all people with cutis laxa will have all signs, symptoms or complications. Symptoms and complications depend on a number of factors, including the specific type of cutis laxa. Symptoms of cutis laxa or dermatochalasia. The characteristic symptom about this condition is loose folds on the body giving a sagging appearance to the patient's face and the rest of the body. The skin on the neck, armpits, groin develops wrinkles, thus giving prematurely aged appearance to the patient. This condition becomes more serious and troublesome when it affects the heart, lungs, intestines, joints and blood vessels, causing prominent darkening and thickening of the above skin. The affected internal organs lose their ability to function over the time, and if left untreated, cause a host of complications to the patient, such as cutis laxa affecting the heart causes supravalvular pulmonary stenosis. Thickening of the arteries cause them to narrow, bulge and tear. The joints stretch more than normal because of excessive laxity of the ligaments and tendons. Some patients may develop hernias and soft outpouchings in the belly button or lower abdomen. In some cases, the eye sclera turns blue. Causes of cutis laxa or dermatochalasia. Generalized cutis laxa or dermatochalasia occurs due to genetic cause. There is no evidence of external factors causing this disease. Depending on the method of inheritance, this disease is classified into autosomal dominant, autosomal recessive, X-linked recessive. According to experts, the autosomal recessive type causes adverse effects like mental retardation, immobility, seizures and delayed development.